Presidential Task Force briefing, and there will be highlights of that briefing later. Meanwhile, President Muhammadu Buhari has written Senate requesting the confirmation of 42 persons as career ambassadors designate. This was also accompanied by 2 other executive communications from the President seeking Senate's approval of 4 nominees as chairman and members of the Nigerian Law Reform Commission. 2 nominees are to also fill in existing vacancies in the board of the Nigerian Deposit Insurance Corporation as non-executive directors. The presidential requests have been referred to the relevant Senate committees for screening. Senate resolved to investigate alleged contributory negligence of not observing standards in conveying explosive materials by the Nigeria police force that was alleged to have resulted in the explosion which destroyed property along Akure-Owo Road. Meanwhile, Senate has paid tribute to the late former Attorney General of the Federation, Richard Akinjide, who died last month. Let's now join Hingino in Lagos for more reports from that end.
Thank you, Naja'atu. Motorists and commuters who ply the Apapa-Oshodi Expressway have to deal with heavy traffic with the commencement of the work on the major route in that axis. Dr. Oguyemi gives an update on the current situation of the location.
Unlike what obtained a few weeks ago, where only a handful of cars plied the roads, the situation after the total lockdown is a complete contrast. Frantic traffic has inevitably returned to Nigeria's commercial capital as essential and non-essential business owners make haste to accomplish the day's work before the 8 p.m. curfew gets in the way. The same can be said of construction workers who were on a compulsory break during the COVID-19 total lockdown. This gridlock is therefore connected to the recommencement of construction on the ever-busy Apapa-Oshodi Expressway. The fallout is a spillover of multiple lanes of cars to as far as the toll gate.
And they need them to hurry up and do it because they are disturbing workers.
The closure of some sections of the road, according to officials of the Federal Ministry of Works and Housing, is to allow contractors speedily complete some portions that would have been completed at the time of the lockdown.
For Apapa-Oshodi Oroshoki, the estimated completion period is going to be towards the end of 2020 up to early 2021. All things being equal, we are still on track.
With the situation on ground, some motorists are forced to cancel their journeys or take alternative routes, while others spend many hours on the road. From all indication, the situation might persist throughout the period of the ease of the lockdown as normalcy gradually returns. In Lagos, Dr. Oguyemi, NTA News.
Following the suspension of the total lockdown, the Lagos State Secretariat Alausa opened its doors to government business in the first week of May, with workers from grade level 15 and above in charge of operations. Adiola Komi Akere, who was at the Secretariat, filed this report.
The Lagos State Civil Service reopened for business after the 5 weeks lockdown on the 4th of May, with only officers from grade level 15 and above permitted to work. Our visit to the Secretariat met a calm atmosphere with operations at a low ebb. However, work was ongoing, an indication that there is no vacuum in governance.
The influx of people into the Secretariat is not as it's supposed to be. You know, we have been, at least you can see the security, they are containing people that are entering and people that are going out. So if you don't have any business at the Secretariat, you'll be turned back. And based on the direction of the governor, we can't do otherwise, because we want this dangerous pandemic to at least leave Lagos State and Nigeria as a whole. That is our prayer.
The selective resumption at the Secretariat, which is aimed at preventing the spread of COVID-19, did not, however, reduce the high number of vehicles on the various roads leading to the Secretariat. Those who spoke off camera said ministries are in full operations and the affairs of the state will not experience hitches. In Lagos, Adeola Komeakere, NTA News.
That's it from Lagos. We now take a break. The news continues shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the last day, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
On Tuesday Live this week, our focus is on the inherent benefit of immunization and sustained primary healthcare service delivery in the midst of COVID-19. This is as Nigeria observes African Vaccination Week. How well are Nigerians keen into this? What lies ahead for Nigerians? Answers and more on NTA Tuesday Live tonight at 10:30 p.m. Don't miss it.
25th February 2020, Nigeria. It is real. It is a nightmare. It is killing people all over the world. It is COVID-19. Compliance with the various states in Nigeria, the current measures will flatten the curves. Shutting down is not an act of wickedness, but an act to save lives. Stay home, stay safe. Observe social distance. Always put on a face mask while leaving your house. Make sure you are on the tricycle alone. Cars and buses cannot carry more than half their passengers. Always remember to wash your hands. Together, we will defeat COVID-19. This message is brought to you by the National Orientation Agency, Nigerian Film Corporation, powering possibilities.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for staying with NTA Nationwide. Let's now join our Maiduguri Network Center where Abubakar is standing by. Well, we've lost the signal from Maiduguri and we'll head up to our next report now.
One of the most significant aspects of this year's Nurses Day celebration
Now, we sincerely apologize for that. It was due to a technical hitch. Now, as Nigeria joins the rest of the world to commemorate this year's International Day of Nurses, the focus is on the vital role played by nurses and midwives in the health sectors around the world. Correspondent Alika Opanachi Arua takes a look at the contributions of nurses in providing healthcare services. Now, we'll take that report in our subsequent bulletin. We'll take the next report now.
In the time of COVID-19, where you cannot import, where you can no more go to pay money anywhere to import goods and all that. Every country is minding their business at this point. So it's what you have that you leverage on. So we have our own people. Look at even the masks. Most of the masks in the market is produced locally. Ventilators now are being produced. So meaning this has already made us to think out of the box. And we need to sustain it.
This is our little token to support the federal government for onward distribution to the sick people, basically for the hospital, in making sure that all of us fight this pandemic.
Meanwhile, local producers and manufacturers in the country have been challenged to support the federal government's one national response against COVID-19 by making their products available for use at this critical time. National Coordinator, African Union Development Agency, and new partnership for NEPAD. Now, that report has already been taken, and so we'll go on to the next report. Maiduguri is back online and will rejoin Abubakar.
Good to see you, Najatu, and thank you for joining us. 200 physically challenged persons in Borno State have received assorted food items courtesy of Northern Governors' Wives Forum as part of efforts to cushion the hardship of Ramadan fast and the prevailing lockdown imposed due to the ravaging coronavirus pandemic. Wife of Borno State Governor Dr. Falmata Babagana Umara, represented by Commissioner for Women Affairs and Social Development, made the presentation in Maiduguri, the state capital, on behalf of the Northern Governors' Wives Forum. The report. One of the major steps of preventing the spread of COVID-19 is through observance of physical distancing, hence the selection of leaders of various associations representing the physically challenged persons for a symbolic presentation to be carried out for onward distribution to the 200 targeted beneficiaries. Borno State Commissioner for Women Affairs and Social Development, Zuwaira Gambo, said wives of the 19 northern governors through their forum deemed it a matter of utmost importance to reach out to the physically challenged persons towards ameliorating their sufferings in view of the Ramadan fast as well as the lockdown imposed due to COVID-19. She charged the people to strictly adhere to all the measures put in place by relevant authorities against further spread of coronavirus pandemic for their safety and the society in general.
This is a very challenging moment for every Nigerian. And as mothers, I think that is what formed their intervention initiative. They know that times are hard because of the COVID-19 lockdown. And again, this is the month of Ramadan, where usually activities are a bit restricted. And so they have identified the vulnerable members of the society.
United States Agency for International Development and Northeast Regional Initiative also presented 1,000 pieces of face masks to the physically challenged persons to complement the foresight of the Northern Governors' Wives Forum. The beneficiaries prayed for the overall success of wives of the 19 Northern Governors in order to continue serving humanity.
Borno State government has pledged partnership with University of Maiduguri in its quest to embark on a research towards finding a cure to COVID-19. Deputy Governor Umar Usman Kadafur stated this while receiving intervention items presented to the Borno State High-Powered Response Team on COVID-19 by the Vice Chancellor of the University, Professor Aliu Shugaba. Memuna Garba reports.
The protective items which were categorized as low-level intervention include high-efficacy alcohol-based hand sanitizer, scientifically proven face masks, and specially formulated bar soaps, all of which were produced at the University of Maiduguri. Deputy Governor Umar Usman Kadafur commended the institution's giant stride in producing the protective items and urged the university to equally assist in sensitizing the public on coronavirus pandemic. He described as commendable the university's efforts to commence research for a cure of COVID-19.
The University of Maiduguri for taking that step, and I also want to assure you on behalf of the state government in any of this research that we're ever ready to partner with the University of Maiduguri to see how best we can come up with.
Vice Chancellor, University of Maiduguri, Professor Aliu Shugaba said the institution has been working on high-tech intervention to curb COVID-19 to include 3D printing of face masks, additive manufacturing with focus on mechanical ventilators and multi-disinfectants, among others. He said the university is concerned with the spread of the scourge, assuring that research is being done to identify some plan for cure, as already a committee has been set up to that effect. On the protective items presented, the Vice Chancellor said all ingredients were carefully selected to provide maximum protection. In Maiduguri, Maimuna Garba, NTA News.
You're on to Nationwide on the Nigerian Television Authority. Let's now return to Naja'atu in Abuja. Good afternoon to you.
Good afternoon, Abubakar, and thank you. Now, joining us via Zoom to talk more on an umbrella group of professionals dedicated to the prevention of substance abuse is the president of the association, Dr. Martins Agoji, the national president, National Association of Substance Use Prevention and Treatment. Good evening.
Yes, thank you for having me.
Good evening, Doctor.
Good evening to you.
Thank you for joining us. Now, could you tell us what exactly your organization does and who the members are?
The Nigerian Society of Substance Use Prevention and Treatment Professionals, ISOP Nigeria, is a registered association in Nigeria, and it is affiliated to the global ISOP, that is the International Society of Substance Use Prevention and Treatment Professionals. She cuts across different disciplines and working in different organizations. For many, the issue of substance abuse requires multidisciplinary approach. It's a non-discriminatory body that embraces every discipline, considering the fact that we all have different roles to play as far as substance use prevention, treatment, and policy is concerned. But our key underlying factor is that whoever is to deliver intervention should be adequately equipped to deliver the intervention for which he has been trained to deliver. Evidence-based is the underlying factor in determining what we do.
So let me ask you this, Doctor. How can your members come in to assist in the fight against the coronavirus pandemic, seeing that there are peculiar issues with those who abuse substances and the coronavirus? In relation to the coronavirus, rather.
Thank you very much. Our concern is that we already have a drug burden, a burden of drugs. For example, more than 14 million people use one psychoactive substance or the other, and that is higher than the global average, which is 5.6%. But in Nigeria, it is 14.4%. 1 out of 7 persons who use drug in Nigeria, that is higher than that. Is 1 out of 7 persons in Nigeria use psychoactive substance. That is higher than the global average of 1 out of 20. Similarly, 1 out of 5 persons who use psychoactive substance in Nigeria is suffering from substance use disorders, and that is higher than the global average of 1 out of 11 persons. So these are our concerns, that Nigeria already has a drug use burden. And coming to the COVID-19 pandemic, what we do, how Nigeria government and as individuals, community, what we do in addressing the issue of COVID-19, we either help to mitigate the problem of substance abuse in Nigeria, or it could complicate the issue of substance abuse in Nigeria, either now or after the pandemic. One of the peculiarities of persons who use substances is the fact that they may not be in the right disposition to maintain the social distancing, maintain other precautionary measures, in order to contract COVID-19. Similarly, by reason of their substance use, their immune system may have been compromised, and that put them at risk. So whatever measure we are putting in place, we need to look at, identify the peculiar needs of this population. Especially now, prevention interventions cannot be provided. Those who may contract COVID-19 and are in isolation center may not receive a professional intervention by persons who have been trained to manage cases of drug or substance use disorders. These are our concerns, even though we're also pledging support to the government at different levels of our professional expertise in supporting or providing professional treatment in all the COVID-19 isolation centers in Nigeria.
Thank you very much, Dr. Martin. Thank you very much. We'll have follow-up questions for you in our subsequent bulletin. And now Jenny Bassi is standing by in Port Harcourt.
Nijatu, and welcome. As the Rivers State government relaxes lockdown for 2 days to enable citizens restock food items, public places, including markets, are experiencing crowd without observing physical distancing. Robinson Darataide has the situation report on the first day of the window.
In a broadcast on Sunday night, Governor Yosun Wike relaxed the total lockdown in Obiakpo and Port Harcourt City Council areas for 2 days. Today, Tuesday, the 12th of May, is the first day of the window of opportunity given to residents to restock. Markets, stores, and gas stations within the city are experiencing panic buying with little or no measure of physical distancing and the mandatory use of face masks. Hike in prices of goods and services played out severely.
Things have increased, and so we have nothing to do than to manage and shop. We are pleading for them to reduce the price of everything, or to open up, or everybody should wear their masks wherever we are going so that we can contact the virus.
Even being in the house for 5 days, they should have gone around to test people before asking us to come out. Now, if people have been infected, now coming out to the market, more people will be infected with this virus.
If the interval was longer, everyone wouldn't have to rush out at the same time.
The situation was more worrisome amongst bank customers who were seen scrambling to grab an opportunity at the automated teller machines, ATMs. A situation which brings to mind that it's high time business owners embrace the use of point-of-sale machines popularly known as POS.
Since 6 o'clock we are here, but we cannot get anything. Even the ATM is not yet operating. We are waiting for them to reopen.
When I came here, I saw that we are not actually practicing this safe distance stuff, and I really felt bad. It's not the best.
The relaxation has also led to gridlock in strategic junctions of the city. In Port Harcourt, Robinson Deratede, NTA News.
In continuation of the fight against the spread of coronavirus in Rivers State, the Rivers State government has formally commenced coronavirus testing at the molecular laboratory of the Rivers State University Teaching Hospital. Ogedi Nyekwere reports.
The Rivers State University Teaching Hospital COVID-19 Testing Center is functioning with 2 PCR machines from Shell Petroleum Development Company and the third from Total E&P. Chief Medical Director of the hospital, Dr. Friday Aaron, said that the laboratory has come on stream to assist the state.
I'm happy to announce that we can now do COVID-19 testing in Rivers State University Teaching Hospital. And the NCDC who are here to install and activate these machines.
He commended the Rivers State government, SPDC and Total, who have continued to support to flatten the curve of COVID-19 in the state. The CMD, however, said that people are not expected to come to the laboratory because samples will be collected from the State Treatment Center at Eleme and the State Ministry of Health. The 3 PCR machines can test 270 samples a day. In Port Harcourt, Ogedi Nyekwere, NTA News.
With the rising cases of coronavirus and the increasing need for accommodation to manage COVID-19 patients, Akwa Ibom State government has employed every necessary machinery to complete the new 300-bed capacity isolation center in no time. Ifeoma Ihoje reports that some complementary facilities at the center have been fully completed.
Sharing the same premises with the long-standing General Hospital Itumbang, the isolation center is an initiative of Akwa Ibom State government in response to necessities of the coronavirus pandemic and directive of the NCDC. This project, which commenced on April 2, 2020, has engaged about 400 skilled workers who work day and night to ensure deadlines are met. The structure, which has 200-room isolation general ward, 100-room VIP ward, administrative offices and other facilities to fit an infectious disease center, according to Governor Manuel, is to avoid a possible waste of resources associated with temporary structures.
I have room at the initial curve before it peaks and declines to actually put up something much better. I have the land, I have everything. So the best thing is, let me put something enduring.
Ifeoma Ihoje, NTA.
Nationwide continues with the Jatu after the break.
Thank you very much. We'll be heading to Anambra State, where Governor Willie Obiano has expressed dissatisfaction with the level of compliance at the interstate boundary, as both human and vehicular movement on Onitsha Bridge is quite high. The governor, who paid an unscheduled visit to various boundaries late in the evening, has directed strict enforcement by relevant security agencies. Ndem Kalu reports.
The interstate boundaries inspected include Bridgehead Onitsha between Anambra and Delta State and Amansi between Anambra and Enugu through the old road. On arrival at the bridgehead, people were seen breaking the rules on boundary closure as heavy-duty vehicles had a long stretch along the express up to the bridge. Governor Obiano, who was very unhappy at the situation, directed that stricter compliance should be enforced at the area.
I'm very unhappy about what I'm saying here. See people trooping left and right. You know? Yes, maybe the vehicles are being checked. That's fine. But see the human traffic on the pedestrian side of the Niger Bridge. No control. That is clearly unacceptable. And I've directed the city on what to do, and I expect him to do that immediately.
The governor, however, commended security operatives at the Amansi boundary charging them to thoroughly check all vehicles to ensure only those on essential services are allowed entrance.
You know, so I want you guys to know that this lockdown is complete. It's not only curfew that we are checking. Only essential vehicles, people with essential items can pass with your clearance, and after inspection, all these big trucks, you have to go in and inspect them thoroughly before you clear them, even if they are carrying drinks or food. Human beings can hide inside there.
People are advised to obey the rules on boundary closure and adhere to social distancing protocols and maintain high personal hygiene. From Amansi in Anambra State, Ndemkalo, NTN News.
Yes, the continuous communal crisis in Taraba State is a major setback to the fight against the spread of COVID-19. Joseph Otsen reports.
There is little water even for the kids to wash off, little food to scramble for, and no adequate shelter for these displaced persons to rest. They have fled their homes to displaced people's camps in Bali, Tela, and Sontai following the latest outbreak of crisis between the Tiv and Ichem people in Mararaban Donga and Bali villages of southern Taraba senatorial zone. The affected Tiv and Ichem communities depend mainly on agriculture as their mainstay, but now they are losing significant time to produce.
You see how a lot of people are gathered. How can you differentiate from people living with coronavirus and those that are not living with it? You can't do that. You can't discriminate. We have to move together, irrespective of the fact that the problem is among ourselves. So I'm appealing to the state government to come to our aid. Let the state government make possible effort so that these people will go back to their places. Let them continue with their work.
We're running at the process of running. You can see that as a sustained injury. And with this incident, our women put to bed prematurely because as they were running, there's yet time for them to put to bed. They deliver the children prematurely.
Food is our problem. Other diseases are disturbing our child. Many of them are dying.
The crisis seems to be benefiting no one, but why it keeps occurring is what many of the leaders have failed to explain.
Presently, we are worried about our people who are internally displaced. We are calling on NEMA, SEMA, and well-meaning Nigerians to come to our aid.
Both communities want federal government intervention since nobody is providing answers to the perennial crisis in southern part of Taraba State. From Bali, Joseph Sound Otsen, NTA News.
And from neighboring Benue State, the Tiv and Chairman Benue State Council of Chiefs, Professor James Ayati, has stressed the need for people to support government in the fight to contain the virus by adhering strictly to preventive measures. Joshua Edino Justice reports.
Since the outbreak of coronavirus in Wuhan province, China, in December 2019, the Nigerian Center for Disease Control says some of the immediate measures to limit the spread are observance of basic hygienic rules. This, the third thief, a professor of biochemistry, James Otese Ayase, couldn't agree more.
We believe very strongly that we will overcome this disease in Nigeria, and therefore nobody should live under fear, but just observe the regulations that have been given. This disease is not a death sentence. Many have suffered from this disease, have been healed and reunited with their families. So nobody should be stigmatized.
The authority urged Nigerians not to live in fear, that if all Nigerians will strictly abide by the rules and regulations as given by the health experts, the nation shall overcome this coronavirus pandemic. From Boko, Joshua Edino Justice, NTA News.
And that concludes NTA Nationwide. Thank you for watching.